pretty much everybody I got? Because what I'd like to do is, we don't have everybody here. I'd like to go ahead and introduce our speaker. And tonight's subject is going to be dealing with anxiety disorders and other problems such as that, actually coping with the acoustic neuroma. Our speaker tonight is Dr. Kenneth Luca. Dr. DeLuca is a psychologist and educator, a fellow with the American Board of Psychological Specialties and American Psychotherapy Association. He is also a board-certified professional counselor. He's been in private practice for over 30 years. He works with children, adolescents, adults, and couples dealing with life adjustment issues, including learning and achievement, ADHD, developmental disorders, anxiety, depression, stress, chronic illness, marriage, relationships, divorce, addictions, bereavement, grief, sexual problems, and phobias. That's a laundry list. In addition, Dr. DeLuca serves on the board of directors of the Nord Center, which is a community mental health agency here in Northeast Ohio. Dr. DeLuca has been a workshop presenter for businesses, professionals, parents, physicians, and school personnel. He's a former school administrator, including superintendent, and Dr. DeLuca has served as a consultant to several agencies, as well as having privileges at hospitals here in Greater Cleveland. Dr. DeLuca has received a number of awards: Award of Excellence from the Ohio Psychological Association for his service to professional psychology in the community. The Ohio State Senate has recognized Dr. DeLuca for this award and his service to the community with a proclamation of commendation. So, everybody, I'd like to introduce our speaker this evening, Dr. Ken DeLuca. And like I said, the two of us are sitting here together side by side. And yeah, what we're going to do is, Dr. DeLuca has a presentation. There's a little bit of visual, so you will be able to see it on your screen. And then afterward, you can ask him questions, and then we're going to do our standard caring and sharing. What we'd like to do is try to wrap it up by 8:30 Eastern time, okay? So, Dr. DeLuca, go right ahead.
Great, thank you, Tom, and it's nice to meet all of you as you introduced yourselves there. What I want to do with you this evening is to talk about coping and dealing with acoustic neuroma and related conditions, of course, because we are one person and we deal with all kinds of things, each of us individually. So I'm going to talk for a few minutes, show you a few slides here about anxiety and its a close partner, which is depression. So we're going to do that. I'm going to at some point ask you to get a paper, pencil, something where you could take notes that you could keep just on a few parts that I want to share with you that are the key parts in terms of coping. And then we'll talk about some other ways of dealing with it, and then open it up for discussion. So we'll begin with the whole idea of, anxiety disorders. Anxiety disorders, and we can go to the next slide. Anxiety disorders are the most common psychological ailment in the United States, which relates to all kinds of issues. In fact, it's the most common disorder among women, and second for men only because the primary one for men is substance abuse disorders. But they're all very close and closely related. So the anxiety disorder can relate to many different kinds of issues that we face in life, different aspects, different things that we encounter, and including, and I'm going to zero in on generalized anxiety disorder if we go to the next slide. This is the most common of all the anxiety disorders, of which there are very many. And it's characterized by excessive, recurrent, and prolonged anxiety and worry. And in fact, what is it about? It deals with agonizing over everyday concerns. And as you can see from the list there, it could be anything from job responsibilities, finances, certainly health, which is what we're here to talk about this evening, health conditions. It could be even common household chores, car repairs, personal appearance. People have anxiety over many different things. And in fact, we can have anxiety of all these different things interrelated. They don't have to be only one thing. But certainly a medical condition is a primary one that can generate anxiety for all of us. The anxiety disorder can also be connected with depression. chronic anxiety and depression can start actually in adolescence, but later in life, particularly in people who are coping with medical conditions or other medical problems. You know, when anxiety is attached to a particular person, place, object, or thing or situation, that is what a fear is. So fears, you know, we hear of the common ones: fear of flying, germs, things like that. But when we attach it to that anxiety to anything in particular or a particular situation, that technically is what a fear is. So fear is anxiety based. Now, the extreme end of all of that would be having panic attacks. And maybe some of us have experienced that at one time or another in the course of our lives here. Panic attacks are, you know, intense fear with physical symptoms that come along with it, such as shortness of breath and dizziness and things like that. And so during panic attacks, some patients become stuck with the fear that they'll lose control of themselves, or they might even suffer more illnesses or may even die. It becomes quite severe at times. So if we can go on to the next one. We talk about what does anxiety feel like. Well, there are definite repercussions from anxiety, certainly. And what we see here, you know, it's the body's natural alarm system goes off at inappropriate times. In other words, not necessarily something causing it in particular that's happening at the moment. Worry circumscribes social life or makes it hard to take care of oneself. May also be a sign of major depression, which can mimic an anxiety disorder. So as you see there, the anxiety repercussions certainly include physical symptoms for sure, and that's what's listed here on the slide that you're seeing. Physical symptoms such as heart palpitations, restlessness, sweating, headaches, nausea, just to mention a few. And the second repercussion from anxieties can be cognitive. Cognitive in the sense that it becomes difficult to concentrate, becomes difficult to pay attention, it becomes very difficult to focus, stay on task, whatever it is you're trying to accomplish or achieve. Then the third area of repercussion from excessive anxiety is psychological, relating to excessive worry, irritability, restlessness, impatience, difficulty being able to stay on task, communicating with others, resulting sometimes even in panic attacks. And then if it gets specific again and becomes a fear, fear oftentimes is called phobias. And so a social phobia is a common one, where we withdraw from outside world activities in terms of what we are crushed by, what we see as negative judgment sometimes from others, and often obsess over, you know, social blunders, things that we think people are looking at us differently, or become very, very self-conscious. So we can go to the next slide. Okay, anxiety disorder is really, in this case, we zeroed in tonight on due to a medical condition. And there are such things as, of course, endocrine diseases, cardiovascular diseases, respiratory illnesses, and neurological illnesses. And the acoustic neuroma is considered a neurological illness, as you all, I'm sure, are well aware, in dealing with this and trying to cope with all of this. We go to the next one. The anxiety is often linked to depression. In fact, anxiety and depression are almost like a ball of yarn. They're kind of wrapped up into each other. And you have one that's highly likely that you may have the other. As you can see there, 2/3 of people with anxiety disorders also suffer from depression at some point in their lives. And 58% of people with depression also will have an anxiety disorder. So we think of us as a whole person, then you understand the ball of yarn. It's like, you know, very difficult to separate, you know, one from the other. Now, the presence of depression in patients with anxiety disorders will definitely increase the severity of both of those illnesses, and can also make your physical illness worse. In fact, the likelihood of alcohol or substance abuse and the risk of suicide are increased dramatically when you have both anxiety and depression kind of wrapped up all together as one. So now, if we go to this next slide, I'm going to talk about Let's see here. Did I skip one? Depression due to medical. The depression due to a medical condition. All right, so depression associated with a chronic medical illness, such as your acoustic neuroma, often aggravates the condition, especially if the illness causes pain and fatigue, or it limits a person's ability to even interact with others. And again, you may have experienced some of this. Depression can intensify pain as well as fatigue and sluggishness. The combination of a medical condition and depression and anxiety, in fact, can also cause people to isolate themselves, which is likely to even exacerbate the depression and even, believe it or not, the medical condition from which one suffers. So I'm going to ask you at this point to have your pen or pencil ready to start jotting down some key points that I would like to share with you in terms of dealing with this and coping with this. And these are critical in terms of how you would begin to cope effectively. And so if we look at the next slide, what do we have control over? So if you don't mind listening to me now for a few minutes, and you can take your notes accordingly. First of all, think with me. You know, what makes us human beings different from all the rest of the other living creatures out there? All animals of different natures. Now, there can be a lot of similarities, of course, but even with, you know, monkeys and chimpanzees, the lookalikes and so forth, but stop and think with me, and I'll share it with you in a second here. You know, what would you say makes us uniquely different regardless of the similarities? Think for a moment. So some of the thoughts that you may begin to have would be the fact that, you know, we can think and reason. They have only instinct. We have instinct too, but we can think and reason. We can make decisions. We communicate at a much more sophisticated level for sure. We are empowered to make choices for ourselves. There's reasons why we're sitting either tonight in the comfort of our home or in another facility and we're not swinging from the trees outside. Because we are able to design things, make things, create things, build things. This is part of our reasoning process, our intellect, and the fact that we are empowered to make choices, which also means that we have a free will and can make choices for ourselves. Now, you know, many writers, to give you a good example of this too, many writers over the years have described the human mind as like a garden plot. And you are the gardener of your own garden plot. So think of it that way. From when we are born, the garden plot of our human mind gets all kinds of information coming into it. And information can only come in through our five senses: tasting, touching, seeing, smelling, you know, hearing. And that's how seeds get planted into the garden plot of our mind. So through our parents, of course, or caretakers, and from all the experiences we have in our environment, which becomes extremely complicated because by the time we're even 2 years old, our mind has already had billions of seeds planted in it that we've begun to cultivate in the garden plot of our mind. And as we grow, we learn more, and our brain grows more too. I had the privilege just last week of speaking to a combination of 3 kindergarten, first grade classes about the human brain and how it works. Okay. And we really zeroed in on 3 major aspects. And it would be the intellect, logic, which means reason. We could reason things, design things. And we talked about emotions, another key part, of course, which we're talking about here this evening. Now, think of that garden plot. The mind is like a garden plot. Now, all kinds of good seeds get planted, right? As we learn from our society, from our family, from schooling and so forth, and a lot of good things grow. But also, what happens to the garden plot each year? Well, all kinds of weed seeds get in there. And weed seeds, anything that would be negative. And we have to be careful about that because those weed seeds that grow, and they can eventually choke out the good things that have been planted or the good seeds that have been planted in our human mind. So when we talk about this, having control of oneself, what do I really have control over? Well, technically speaking, we really have control over only one thing, and that's ourself. That's our human nature. That's the fact that we are empowered to make choices for ourselves, and as a result, we have free will. So what happens to us? Well, we can surrender control of ourselves. We can surrender control of ourselves to anything that's certainly negative, and hopefully we would allow the positive things to control us, but we have to make a conscious choice. Now, with your pencils and pens there handy, let's go off to the side for a moment, and let's talk about the three major levels that the human mind functions on. And think of this as a plant growing in the ground. We have the seed, the roots in the ground. That's our unconscious level. As we get close to the surface, we have the subconscious level. And as the plant grows above ground, that's where we have the conscious level. So if we start at the top, we have conscious, subconscious, where the seeds are planted about 6 inches below the surface, and down deep where the roots grow, that's the unconscious level. That is extremely important for us to understand because it is only at the conscious level that we can exercise our power of choice, our free will, where we can decide for ourselves what we want to do, what we want to accomplish, what we want to achieve, and also to become very consciously aware of how we can let other things, especially negative things or negative seeds, control us. So if we go back to our garden plot analogy for a moment, as we continue to grow through life, we can decide when I want to take control of myself. So we go to the next slide. I have control over one thing and only one thing in life, you and I and each one of us, and that is ourselves. That's the one thing we have control over. Now, we don't have control over what happens to us, but we certainly have control over ourselves, which means that we have control over how we choose to react to things. So here's an example. People will surrender control of themselves to negative thinking. People will, examples. What happened to the alcoholic or the drug addict? Well, the substance is in control. They're no longer in control of themselves. Sad to say. So it's a serious illness in our problem, in our society. They've surrendered it, but you know what? I have never yet met someone, or have I ever met somebody else who's met someone who made the conscious choice to become an alcoholic or to become a drug addict. It happened to them. It happened to them unknowingly. So you know what? If we walk away from the garden plot of our mind and we don't pay attention to it, what happens? Well, the winds blow, all kinds of seeds get planted in there, and a lot of them can be weed seeds. Till the day comes when we come back to it and we can see and check our garden and say, wow, I got good things in there, but I got a lot of weed seeds. Now it's up to us to decide if I'm going to keep the good things and if I'm going to begin to pull the weeds out of the garden. And when I decide, say, for example, to plant tomato seeds and grow tomatoes, what do? After the planting is done, I water, I fertilize. Now I come back every day and check the garden plot of my mind. And I make sure that it stays clear of weeds, bugs, slugs, anything that can interfere with the growth of the good seeds, tomatoes or others that are planted in there. But every day I check the mind. Every day I check the garden plot, because the weeds we know can take over if we ignore it, don't pay attention to it, let other things affect us. that we don't necessarily want to have in our lives. So to exercise that free will, we have to be at the conscious level. When we do that, we decide on the seeds we're going to plant at the subconscious level, which will grow deeper into the unconscious level, and we feed those from the conscious level day in and day out. So that is a key part to understand here, because you and I really only have control over one thing and only one thing, ourselves. Now, with that type of understanding, the key thing then is, okay, well, what can I do to help myself? Well, what you can do to help yourself, next slide, since you only have control over yourself, is this. Each and every morning, because remember, as human beings, one of our common characteristics with the rest of the animal kingdom is that we can be creatures of habit, okay? So that we get into habits. We all know that if we have good habits, we benefit, and if we have poor habits, okay, then we suffer the consequences. So we're always trying to replace those poor habits, take those weeds out, and boy, those weeds can be stubborn sometimes, right? They keep coming back. Well, we have to keep paying attention to the garden every day and cultivate the positive seeds, the good seeds. So what can I do? Each and every morning, when you get up, before you do anything else, before you have a cup of coffee, before you pray, before you brush your teeth, certainly before you turn on the news, anything like that, even though Tom is a newscaster here. First thing you want to do is say to yourself, I have control over one thing and only one thing, myself. Therefore, what can I do to help myself do better today? Let me say it again. I say to myself, I have control over one thing and only one thing, myself. Therefore, what can I do to help myself do better today? You write that down, that's the key thing here. And what I would like to suggest is going to be the number one thing you tell yourself each and every day when you start off with, I have control over one thing, myself, only myself. What can I do to help myself do better today? Number one is this. Whenever I have any kind of negative thinking, we're going to call that stinking thinking. So number one is whenever I have any kind of stinking thinking, I immediately tell myself, time out, stinking thinking. I'm not going to let this control me. I'm staying in control of myself. Stinking thinking. I'm not going to let this control me. I am going to stay in control of myself and divert your attention onto something else, preferably positive thing. Now that sounds pretty simple, but you know as well as I do, it's not easy to exercise every day, is it? No, in fact, this is something you want to practice each and every day now. And I don't care if you say this to yourself 952 times during the day. You can say it and practice it a lot quicker than I can explain it to you. So I have control over one thing and only one thing, myself. Therefore, what can I do to help myself do better? Number one, whenever I have stinking thinking, I tell myself, whoop, time out, no stinking thinking. I'm staying in control of myself. I'm not going to let that stinking thinking control me. Redirect your attention onto something positive. You can move on to your list. We're going to have some other things here in a minute that you can keep on your list to keep focusing on, but this has to be number one. And why is it so critically important? Because what this allows you to do with a lot of practice now, and that is you stay in control of yourself and you stay in control of your thought processes. And we don't let those weeds start to take control, all right, and lead you in a direction you don't want to go in. Now, all of us have had weeds, and all of us have had weeds take control at times. And we know when we stay focused on the weeds, it's not a good thing. It causes us problems, causes us issues, causes us concerns, causes us heartache, and so forth. Now, remember, I did say earlier that we only have control over ourselves. We can't control what happens to us. Now, for example, I had a man a few Februaries ago come in and here in Cleveland. It was a cold, dreary, sleet-driven, gray morning, and he was an 8 o'clock patient. And I had been working with him on this, and I came out and I said, welcome him. I said, come on in. How are you today? And he said, terrible. I'm doing terrible. I said, why are you doing terrible? He said, because this weather makes me terrible. I don't like this weather. I said, come on in. I don't like it either. So he sat down. And I said to him, really, the weather is bad? I said, oh, this weather, I hate it. It just makes me miserable. I said, look it, I don't like the weather either, but I'm not going to let it control me. I knew the man had lived his whole life here in Northeast Ohio, and unfortunately, when you get to January and February, the weather's like that a little bit here, thanks to the Great Lakes to the north of us here, and the winds coming up out of the northwest. So I says, you know, you're letting it control you rather than you staying in control of it yourself. So I don't like it either, but I'm not going to let it ruin my day. And he finally got it. He finally got it. So that could be, it could be anything as simple as that. Well, maybe not as simple as that, but it could be anything that we suffer with and so forth. I've had knee replacement, hip replacement, back surgery. I almost died from a couple of illnesses, and thanks to modern medicine, I remind people I wouldn't be sitting here today if it wasn't for medicine. Could I have let those things depress me, got me down? Yes, I could have, but I wouldn't let that happen. Now, as a result, I've lived a pretty decent life, I have to say. There were a lot of ups and downs, of course, just like all of you have experienced. But if you stay in control of your mind and keep reminding yourself constantly, day in and day out, no stinking thinking, I'm staying in control, then you'll start to live a much better life, a much better existence. So we go to the next slide. There it is. You see, no stinking thinking. Okay, you have it in your hands. You are empowered to make that choice. You are empowered to make that choice. We just allow ourselves to be led or to be controlled by other things, or let other things have a negative impact on us. So a lot of times, especially even with young people who get down and depressed and so forth, you know, this is not a good time to be watching the news in the evening. So I suggest don't watch it. You know, I mean, we're all trying to cope with this COVID, you know, thing, and we have no control over it. So worrying about it or being upset about it or letting it depress us or being anxious about it isn't going to help. Okay. All we can do is follow the safety recommendations that are provided to us and practice them and do what we can so that we can stay as healthy as possible. No stinking thinking. Okay. Now, if we go to the next page, we can talk about some other things that you can add to your list. All right. Exercise. Exercise is extremely, extremely important. We have learned more and more from research as time has gone on how critical physical exercise is to our human bodies, including our brains. You know, one of the questions the kids asked the other day was that, you know, how does the mind or the brain get the energy to work? And I said, this was a perfect question because they were just getting ready to go to lunch. I said, that's exactly where it's at. It is in the food that you consume. Okay, good health begins in the kitchen. And that's for the body and the brain in particular, right? Because our body digests that food and breaks it down, and that is where the brain draws its energy so that it can function properly and we can exercise our freedom of choice and exercise our free will. So exercise is extremely important. More and more research studies show that cancer hates exercise. it doesn't like it. Isn't that interesting? Doesn't like it. So if you're suffering from cancer, exercise more. Now that's physical exercise. Now, let me caution you, always make sure you check with your medical doctor to see what appropriate exercises you can do depending on your particular condition. So that's very, very helpful. Breathing. Well, breathing relates to mindfulness. Now, mindfulness is another great way to help yourself do better, to add to your list. What is mindfulness? Mindfulness, you may want to jot this down. Mindfulness is the practice of focusing attention. Mindfulness is the practice of focusing attention on what is happening in the present. Focusing attention on what is happening in the present and accepting it without judgment. Accepting it without judgment. And that many physicians and therapists believe can be a powerful therapeutic tool for you. So mindfulness is the practice of focusing attention on what is happening in the present and accepting it without judgment. Now, mindfulness is often learned through meditation. Meditation is a systematic method of regulating attention by focusing on your breathing, a phrase, or an image. So let me say that again. Mindfulness is often learned through meditation. What is meditation? Meditation is a systematic method of regulating attention by focusing on your breathing, a phrase, an image, could be praying, could be whatever you want to focus on, okay? Regulating your attention to do that. So mindfulness, which leads to meditation, is extremely important. So breathing relates to mindfulness. If you pay attention to your breathing. Now, there are a lot of great techniques. There's a lot of great resources out there, to help you learn about mindfulness. It isn't so complicated as it may seem, but it takes practice. Now, here's another thing that we have got to be careful about and make sure we have no stinking thinking with. We live in a society, we live in a culture that keeps trying to inculcate in us the quick fix mentality, okay? Come take a pill and you'll feel a lot better. Well, we all know that that doesn't work. Even though our society and our culture tries to make us think that way. But what does it do to us? If we follow that without thinking, which means we start to have stinking thinking if we aren't thinking properly, okay, we give up. Good exercise requires daily exercise, daily use, regular use in order to get stronger, to get better, and so forth. Well, same thing with the human mind. So we have to keep practicing this no stinking thinking to stay in charge of yourself. Okay, you practice mindfulness, you practice meditation, and guess what? Gradually you get better and better and better at it. And as a result, your garden is growing just positive things, the things you want to grow, and much less weeds. And who's happier? You are. So is it work? Well, yeah, it's work, but guess what? You're not going to expend any more energy doing this than what you did in a negative way when all the weeds were growing. You're going to expend the same amount of energy, only you're going to be in control of where that energy is going. So you see now a couple other things there. It says, don't worry about yourself, which means share, talk with your feelings. One of the things I did with the little kids last week is read a little story about Ruby has a worry. And her worry kept growing and growing and growing, okay, until she met another child who had a worry too. And when they began to talk with each other about it, then the worry started to go away. In other ways, we share our feelings with others. Certainly, you can do this with a close person to you, a friend, a relative, a spouse, whatever the case might be. Now, you know what? It's also important to consider the fact that you can combine all of this, mindfulness, meditation, sharing and talking, with psychotherapy, especially cognitive behavioral therapy. Okay, so with a psychologist, a licensed professional clinical counselor, people who are educated to help you help yourself deal with these things. And you talk them through, and they help you develop other techniques and include the ones we're talking about to help you get yourself better. So this, of course, the most common approach in psychotherapy for this is cognitive behavioral therapy. So if maybe you've already done some of this. That's very, very important. And of course, it's that, and many times it can be medication combined with psychotherapy, okay, which is the best way to treat depression and anxiety, is to have a combination of those if necessary, or strictly the psychotherapy. Now, medication helps to stabilize the human mind biologically, and that's extremely helpful. But is it going to solve your problems for you? That's where the psychotherapy comes into play, all right? And following the techniques and approaches that we've been talking about here this evening. So, you know, both of those, psychotherapy and medication, share the common goal of helping people move away from self-destructive thinking, okay? No stinking thinking, right? Now we go to the next slide. We'll see here that this is definitely a resource here. I want to add another one, and I'll come back to the resource on your slide here. But an excellent resource is the Anxiety and Phobia Workbook. It's entitled the Anxiety and Phobia Workbook. And that would be the latest edition, which may be the 6th edition, if I'm correct at this point. And the author is Edmond, E-D-M-O-N-D. E-D-M-O-N-D. J is his middle initial. And his last name is Bourne, B-O-U-R-N-E, Ph.D. Edmund J. Bourne. The title is the Anxiety and Phobia Workbook, get the latest edition, okay? And this has been in existence for a number of years, but it keeps getting updated. And so that would be, it's very, very practical and will relate to all kinds of issues, all kinds of anxieties, depressions, the interconnectedness between this, mental conditions, you know, as well as other issues in your life, and what are some of the best ways to cope more effectively with it. It's an excellent resource. Now, as you see there, the website www.mindful.org, dedicated to sharing the gifts of mindfulness through content, training, courses, and directories. And this is through an organization you see listed there toward the bottom, I think, www.couragetocaregivers.org. And that's a local phone number, 216-536-7699. And one of you expressed earlier in your introduction help for caregivers who are helping people with acoustic neuroma or other issues related to it. And of course, helping them to cope with any of the anxiety, depression, psychological issues, physical conditions that come with it as well. So this is an excellent resource. They can give you some help. They do teach classes virtually on Zoom, meditation classes, and so forth. So they are listed there. At least that's one organization that you can go to. You may have also heard of EMDR, which is a therapeutic technique or approach. EMDR stands for eye movement desensitization and reprocessing. Eye movement desensitization and reprocessing, EMDR. This requires special training by the therapist to work with the patient. EMDR, eye movement desensitization and reprocessing. Especially if you've had traumatic experiences in your life of one kind or another, or a series of them, or different things related to each other. And what is a traumatic experience? It all depends on you, the recipient, what happened to you, okay? Which may not be traumatic to somebody else, but it was traumatic for you. That's the most important thing. So that's just another therapeutic approach that can be used by a psychotherapist, you know, a psychologist, licensed professional clinical counselor, licensed independent social worker who's focuses on mental health treatment. So mental health, now we got one more area here to cover. It's what we're dealing with here every day these days, COVID-19. This has complicated all of our lives. And certainly whatever conditions we have, this makes it even worse. Now people are suffering more. We're used to being able to be free to go and come as we please, do different things. And we've been very restricted now for several months, what we can do, where we can go, even seeing family members. I know one of you said you're originally from Honolulu. We have a son who lives in Honolulu, who's married, has 2 children. And we were there in March when we had to leave and come home because of the COVID, before we didn't know what would happen. So we did come home, haven't seen them. Thank God for FaceTime and Zoom and these kind of things where we can visit with each other and see each other. I mean, we have another child and grandchildren and a marriage in Atlanta, Michigan. None of our kids are right here. But thank God for this, this technology of ours. It really helps us, right? Meanwhile, you want to interact if you can. Many people are not able to go to church, but you can streamline the services. You can watch them daily or on Sundays. You can stay connected in different ways through the use of technology. And certainly, if we practice all of the safeguards that we are being recommended to follow, this too shall pass. Tom and I were just talking earlier before we started tonight. Both of our parents had served in both our fathers had served in World War II. And, one of the things every year on my birthday that I like to do is I like to especially remember and pray for my parents, remembering what it was like on the day that I was born, their firstborn. And I chuckle a little bit because I will say, well, if it wasn't for World War II, I might be 4 years older. That was about the only thing good that came out of it. But you think about the hard times, the difficulties they had to suffer through, depression, growing up. And then the war. I mean, everybody suffered during that war at home as well as abroad. We are far removed from what real suffering or more intense suffering is. So to complain about wearing masks, come on, is that such a big deal? Or staying home when we can, not trying to go out. We should still get out and walk and get some exercise wherever we can without having to interact with a large group of people. But I think this just puts another layer on top of everything else that we're trying to deal with and we're trying to cope with. So you hang in there, make sure no stinking thinking now. That's got to have the same no stinking thinking with this COVID as you do with just about anything else.